welcome. Today I want to talk about depression. At times everybody fall into some doldrums and luxuriate in a bit of self-pity and melancholy. But depression is very different, because for someone who is depressed, the feelings of sadness and loss stretch into weeks and months, and he or she feels that there is no end to his misery. And a depressed person is characterized by a strong conviction that things will never ever change. Now, the numbing despair seems to last forever. A depressed person finds that his or her energy is sapped, and he or she thinks, a way of thinking is warped and often clouded by negative, gloomy thoughts. Now, no one is immunized against this malady, whether rich or poor, because depression is so ubiquitous, that it is now referred to as the 21st century's common cold of mental illness. Think about that. Now, politicians and artists and prominent business people have all been visited by bouts of despair. You remember Abraham Lincoln, the famous and very successful American statesman and politician? He once wrote, "I am now the most miserable man living, and if what I feel were equally distributed to the whole human family, there would not be one cheerful face on man." Now, 15% of those people who suffer from the more severe form of depression, which psychiatrists call major depression, will ultimately commit suicide. And that is sad. Now, recent research, however, indicate that depression is not only a serious disease, but it can be accurately diagnosed and even effectively treated. And depression occurs as a result of the interaction between biochemical and genetic and psychological factors. And changes in a person's lifestyle, for example, loss of a job, like in this case of COVID-19, death of a relative, and all these things, combined with innate factors to precipitate depression. And there are antidepressant drugs available with milder, fewer side effects, for example, Prozac, that can be described by a psychiatrist and a mental health professional to treat depression. Now, similarly, cognitive psychotherapy, cognitive counseling, developed specifically to attack the disorder, has been shown to work tremendously. Now, what cognitive counseling does is it corrects thought patterns that generate negative feelings and black moods. Now, relaxation has also been shown to be effective, and physical exercises too. In fact, they alleviate a milder form of depression, because what happens is that when a person exercises, the brain releases certain chemicals that mediate mood. They're called endorphins. Now, research conducted in the USA revealed that a combination of treatment models, that is psychological counseling and antidepressants, was more effective rather than just one of it alone. And a number of studies have also shown that less severe depression can be treated by counseling just by itself, and it works as well as antidepressants. Now, that is quite a significant finding and very interesting, especially when you consider that all antidepressants usually take about 4 to 6 weeks before patients begin to feel the full effect, the good effect of the medication. Now, let me talk a little more about some facts about depression. 80% to 90% of those who seek treatment for depression can find relief either through antidepressants, or psychological counseling, or physical exercises, or being taught relaxation responses and biofeedback. And very important to know that many more men than men experience depression, and puberty seems to be the dividing line. Before puberty, both young girls and boys seem to feel gloomy, almost in equal numbers. But after adolescence, girls' depression rates soar And this could be, experienced as a result of a combination of physiological, psychological, and social factors. For example, hormonal imbalance, and also how men and women have been socialized to deal with emotions, and women are more susceptible to sexual abuse and violence due to their lower socioeconomic status. Another fact that is worth knowing is that 2/3 of those who have depression do not get the help they need. And often it's because they do not admit the problem, or they even do not recognize its signs and symptoms. In fact, many people who have major depression wouldn't even call themselves depressed. That's how serious it is. Now, there is no physical test per se to pinpoint the disease as yet. But what psychiatrists and doctors and psychological counselors, and other mental health professionals look for are a constellation of symptoms that last for longer than 2 weeks, and these include, a nagging sense of sadness, lack of interest in previously interesting events and activities, indifference, apathy, that persistent loss of libido, no sex drive, no energy. There are other, conspicuous markers. For example, sleep disturbance, insomnia, or appetite disturbance, not desiring food or sex, that fatigue and lack of concentration, restlessness, lethargy, feelings of worthlessness and sadness, and even suicidal thoughts. Now, all these are risk factors that raise a person's vulnerability to depression. And of major contribution is recent stress, followed by family history of the disorder, genetics and inheritance. And also the personality makeup of an individual. The stressful events can also be cited as key triggers of a depressive episode. Lack of social support, a life history of trauma, especially childhood trauma and loss of a parent, or rape or sexual abuse, divorce, illness, retrenchment, loss of job, loss of poverty, bereavement. All these are, pretty good predictors of depression. All these can actually precipitate depression. There is a strong link between depression and alcohol consumption. Although it is not always clear, which is the cause and which is the effect, but a reciprocal relationship nonetheless exists between the two. It is true that some people drink alcohol so that they may soothe their hearts and ease their sorrows, self-medicate. And yet people, especially men who are already alcoholics, may develop major depression. Now perhaps this is because prolonged intoxication eventually unbalances brain chemistry. At its most fundamental level, mood regulating neurotransmitters, the chemical messengers that transmit electrochemical signals, between brain cells, they underlie the depression. And two of these are norepinephrine and serotonin, and they appear to have much to do with depression. Now, increased collaboration between medical doctors, psychiatrists, and psychological counselors and psychologists is required in treatment of depression. And every research conducted on the efficacy of psychological counseling in the treatment of depression, when it's juxtaposed, when they are all juxtaposed with many clinical trials of antidepressants, they all point towards one conclusion, that whatever drugs do to the brain chemistry, imagine, effective psychological counseling can also do it. How? Well, attitude changes biology, and biology changes attitude. Now, people who obsess, over problems and they ponder over them, and negative implication of this, they can find themselves sucked into the cycle of gloom, and more women are more likely to stay depressed than men, because women have been socialized to acknowledge emotions, while men, ever since they were boys, were never permitted to ruminate over issues. Rather, they were made to distract themselves with outdoor activities. And boys don't cry, so they say. Now, depression is chronic, and since it tends to recur, depressed people who undergo, psychological counseling have a better chance of staying depression-free over, a period of time, because through therapy, they learn psychological techniques that help prevent relapses. And this is important because unlike pharmacological interventions, that is drugs prescribed by the psychiatrist, which mostly help in merely suppressing symptoms. Now, in a very recent study, in the Archives of General Psychiatry, American researchers found that 75% of depressed people in each of two groups treated with either medication, that is antidepressants, or cognitive therapy, they all felt well enough to stop treatment after just 3 months. But over the next 2 years, 50% of those who are treated with medication relapsed into depression, while only 20% of those who are treated with psychological therapy did. Now, that is a strong indication for what counseling can do. Now, doctors tend to keep a patient who might relapse, for longer periods of time in antidepressants. And a typical episode of depression is allotted about 6 to 9 months of drug treatment period. Now, there are probably no nasty complications or discovered risks associated with prolonged antidepressant use. The risk of unknown side effects cannot be ignored. And that's why I would say counseling and psychiatry must, work together in treating depression.